explore applications of technology and medicine. See how experts prevent, diagnose, and treat today's most traumatic illnesses. Discover the latest breakthroughs in healthcare on World Business Review's Health Journal Television.
Welcome to Health Journal Television. I'm Norman Schwarzkopf. Everyone knows we need daily exercise and a diet supplemented with vitamins and minerals to keep our minds sharp and our bodies healthy and strong. Our mouths are no exception. Calcium and phosphate are of paramount importance in maintaining good oral health and beautiful smiles. Joining us today is John O'Neill, Vice President of Sales for GC America. Welcome, John.
Thanks, General. Thanks for having me.
And also joining us today is Dr. Ed Hewlett, Associate Professor of UCLA School of Dentistry. Welcome to you, Ed.
Thank you. Good to be here, General.
Ed, tell us about the importance of calcium and phosphates as a dietary supplement for healthy teeth.
General, calcium and phosphate are two of the key building blocks of tooth enamel. They help enamel be very hard, to resist decay, and to resist wear over time. As we start to lose those important minerals from enamel during our lifetime, the teeth can become more susceptible to decay. So if there's a way to put those minerals back into the teeth, we can continue to keep them healthy and strong throughout life.
So, John, what is GC America doing to help?
GC General has worked closely with top scientists at major universities worldwide doing research in this area. As a result of this collaborative research, we've actually developed products such as MI Paste and MI Paste Plus, which can actually deliver freely available calcium, phosphate, and fluoride directly to the enamel.
For more, let's go to this Health Journal Television field report.
We put our bodies through stress and sometimes neglect throughout the daily routine of living. Our bodies need rest to recuperate and vitamins to restore missing minerals. Our teeth also need vitamins to remain strong and healthy. MI Paste Plus helps prevent decay and sensitivity, keeping our smiles confident and bright.
In my opinion, with an aging population, many of my own patients are taking many medications. Some of them are undergoing chemotherapy, some are undergoing radiation treatment, and all these have side effects of dry mouth. And dry mouth isn't just an uncomfortable situation, but it can also lead to tooth decay.
Many people today are opting for affordable cosmetic dental makeovers. These procedures help correct problem teeth that were not good to start with.
Dental makeovers can last for a long time, but there's nothing that the dentist can do for the patient that will make up for what the patient doesn't do themselves. And this can be done in several ways on a regular basis, but it's very key to be sure that the patient uses their current technology to enhance their saliva and to help the nature's processes to give the best function and strengthen the teeth the best. The minerals that are most active and help the teeth stay the strongest, the longest: calcium, fluoride, and phosphate. Those things are found naturally in the saliva, but when we enhance them and help drive it into the enamel, into the dentin, we preserve the teeth for a much longer period of time and actually harden the structures that are naturally in your mouth, which in the long run makes the dental procedures look good and last longer for the patient, which is exactly what the patient wants.
For Health Journal Television, I'm Michael Clark reporting.
John, what are the latest trends in dental care today?
General, technology has changed dentistry in many, many ways. We've gone from cosmetic makeovers to minimal intervention dentistry. We have a much, much better understanding of the disease caries and the management process for those caries. As a result, today we have the ability to, in some cases, reverse white spot lesions, which are, decay, which is just starting. We can actually regrow enamel in some cases. It's really come a long way in its ability to treat caries.
What is the most commonly requested cosmetic dentistry treatment today?
General, everybody wants bright white teeth these days. So tooth whitening is far and away the thing that most people come in and ask for when they visit the dentist.
How do dental schools like UCLA adapt to the changing needs of the public?
Well, General, it's our responsibility as educators to follow these trends, and if not even anticipate them. And then we use the best available scientific evidence in order to train new dentists to be able to address these trends and changes as they occur.
Tell us about MI Paste Plus.
General, everybody knows for years the benefit of milk. You know, that you have stronger teeth and stronger bones due to the calcium. Well, through technology, GC has actually been able to manufacture a product whereby we can deliver calcium, phosphate, and fluoride directly to the tooth structure.
Ed, how is it applied?
Very, very simple. You take the product and wipe it on the teeth with a clean finger. It couldn't be easier. You spread it on the teeth and you leave it sit there for 3 minutes.
What is the science behind MI Paste Plus?
Well, as John mentioned, MI Paste Plus contains these building blocks of tooth enamel: calcium, phosphate, and fluoride. It contains them in the exact same ratio, 5 to 3 to 1, that they occur in the mouth, that they occur in nature. So it's essentially just supplementing what the saliva should already have so that it works at its best to protect and heal the teeth.
Okay, then who benefits from using MI Paste Plus?
Ooh, lots of people, General. In fact, it's hard to imagine who wouldn't benefit from it. But as I mentioned earlier, people with dry mouths, for whatever reason that may be, people that don't have as much saliva are going to benefit quite a bit. People who have sensitivity. When people whiten their teeth, it's a very popular procedure, but a common side effect is sensitivity. It can help those people. It turns out that there's lots of beverages, sports drinks come immediately to mind, that happen to be acidic. They can start to dissolve away some of the enamel if you drink a lot of that. The MI Paste can help put that back for people. And people who have had smile makeovers, people who have had extensive dental treatment and want to maintain it so that it continues to look beautiful, those people are going to benefit from using MI Paste as well.
So what should I expect after using MI Paste Plus?
Well, in addition to a pleasant experience, because quite frankly, it tastes good, easy to use, but what you'll expect is healthier, stronger teeth as a result of using it.
So what do you see for the future?
I see more and more of the medical model in dentistry. In other words, dentists will be actively trying to heal caries at very early stages and reverse them rather than surgical, rather than cutting the tooth structure out and filling it. It's going to be more of a medical model, healing model, if anything else.
And Ed, how do you see the future?
Well, I couldn't agree more with John, and that's why it's so exciting for me to be a dentist right now, because we've always been a healthcare profession, but now we're becoming more healers rather than repairers, and technology is enabling us to do that and to make dentistry more comfortable and a more satisfying experience, quite frankly, for the patients that come and see us.
John, thank you very much for being here for this very important subject.
It's a real pleasure. Thanks, General.
And thanks to you, Ed, for being here.
Thank you. Very good to be here. Appreciate it.
And thank you for watching. Until next time, for Health Journal Television, I'm Norman Schwarzkopf.